The potential student, I'll give maybe some examples. One example would be the doctor who works for a network or an institution where it's clear that there's a need to take care of patients with chronic pain, but they don't have the expertise in their medical clinicians to do this. So the doctors may be interested. There may be a family practice doctor or an internist or a pediatrician who's very interested, but they don't want to stop their careers and do a formal fellowship. So this is an opportunity for them to build the expertise that they can now use this knowledge to enhance their existing practice and maybe serve their institution. Frankly, I think there are institutions that might pay for some of their doctors or pharmacists or nurses to get the education, because we think this will be so valuable to the institutions that they go back to. So similarly, if a physical therapist may be very well trained in helping somebody with a sports injury and really have very little background, how do I approach the chronic pain patient? And to acquire that knowledge, again, not necessarily on the practical level like they would if they could do a fellowship, but there is no fellowship in pain management for physical therapists. They will at least get the background that now they can enhance their existing practical knowledge in their practices. Pharmacists, more and more pharmacists, both in the community pharmacies, but also the more academic pharmacists in university environment, are being called upon to help the institution, the care teams, to deal with the pain management, the pain medications. So again, there's no formal fellowships for pharmacists. So this is the kind of program that we think that they can use to enhance their existing knowledge and practice. It could be somebody in another country outside of the United States, outside of North America, that doesn't even have any opportunities to get this knowledge in their own country. And this is really maybe one of the only programs that would allow them to develop expertise in pain medicine. So I think there's such a wide variety. Psychologists, health psychology is a very growing specialty, yet even in the health psychology area, many of the health psychologists don't feel comfortable that they know how to help the patient with chronic pain, how to assess the degree that emotional factors are contributing and layering onto the pain problems, how to sort out addiction issues from other issues. And these are the things that their team is turning to the psychologist to help them with. So we're hoping that after completing a course like this, the psychologists will feel like they've really added to their knowledge base and can do these kinds of things more effectively. Success for me would be that their personal practices improved, that they were able to make a difference at a team and institutional level, and maybe even start bringing an educational component into their professional or patient communities. So the feedback that we get from our graduates will be our immediate signs whether or not we are successful. 20 years down the road, I'm hoping that there'll be other programs like ours, that we will see that more and more doctors, more and more physical therapists, dentists, psychologists, occupational therapists are comfortable, that they know what to do. They know how to recognize these problems, think about these problems, classify these problems, diagnose, if it's appropriate for them to diagnose, and how to be an effective participant in the patient's treatment.